We start in the US, where New York is honoring the 1 million essential workers who were vital to the city's survival during the pandemic. They treated the sick, cleaned hospitals, stocked grocery shelves, and delivered meals to millions of residents during months of lockdown. But while they're being hailed as heroes, their salaries don't reflect their worth. Paolo Montecillo has more.
A ticker tape parade down Broadway. It's an honor that's been bestowed on presidents, astronauts, and Super Bowl champions. This time, New York is celebrating the people who helped the city during the COVID-19 pandemic.
Our healthcare heroes, who were extraordinary and need to be remembered for the ages, our first responders, our essential workers, the people who kept us alive, the people who kept the city going no matter what.
Together with medical staff, the event recognizes workers from a range of essential services, including public transport, shopkeepers, and cleaners. It's also acknowledging funeral home employees who were directly involved in laying to rest or cremating the 33,000 New Yorkers who've died of COVID-19.
No one is going to ever forget those we lost and what families are still going through. But we need a day to celebrate the heroism of everyday New Yorkers.
These 1 million people account for 25% of the city's labor force. And while they're being called heroes, many are severely underpaid, don't own their own house, and travel long distances to and from work. Research by New York's comptroller shows a quarter of the city's frontline workers live at or below twice the poverty line. That includes nearly 1 in 10 who earns less than $26,000 a year before taxes. And 8% of employees in this group lack any kind of healthcare coverage. 75% of New York's essential workers are non-white, including delivery drivers, who are overwhelmingly Hispanic. There are 80,000 in the city, and some are forming a union to demand better working conditions.
One example is access to a restroom. Many times restaurants deny that to workers. It's an essential service. We're not asking for anything special, but the worker is denied that.
Being a delivery driver isn't an easy job. It's dangerous. There are accidents. You encounter many people on the streets who don't respect traffic lights or signs.
Members of the union say it's people like them responsible for the most basic needs of a community who New Yorkers relied on when the pandemic was at its worst, not the lawyers and bankers for which the city is best known. And while parades are fun, they do little to improve lifestyles or living conditions. So perhaps it's time for New York City to put its money where its mouth is. Paolo Montecillo, TRT World.
And TRT World correspondent Frank Ucciardo joins us from New York. Lovely to see you there, Frank. Now, ambulance drivers and ambulance crews are also essential workers. Why are so many of them boycotting this event?
This parade, of course, as you saw, was about celebrating essential workers, firefighters, police officers, healthcare workers. But in this parade today, there were no medics, there were no EMTs, there were no ambulance workers because they are in the middle of a very contentious labor contract dispute with the city of New York. They're claiming they really don't get paid enough, and they really don't. These were the very people that had to take COVID-19 victims from their houses into the hospitals, and in many cases we're told if the victims died on the way to the hospital, they couldn't even bring them in the hospital. So they had probably the worst job in this entire city during the height of the COVID-19 crisis. But then again, the parade here, which occurred in the Canyon of Heroes just behind me here today, went off rather smoothly. There were more than 24 floats. There were more than a dozen organizations throughout the city that represented essential workers, and we saw thousands and thousands of the people marching in the parade today. Back to you.
Now, as Paolo mentioned in his report, delivery drivers, of course, have been critical during the pandemic, but now as restaurants are opening up and offering dine-in services again, of course, they need staff to be able to do that. How smoothly is that transition taking place?
The restaurant industry, of course, employs so many people here in the city of New York. When that shuts down, the city's economy is really affected. Now, the restaurant industry got about $28.6 billion as far as a cut from the federal stimulus package to get back on its feet. However, they ran into another problem. During the COVID-19 crisis, many of their essential workers left New York City. They fled to other places where they could find a job, even out of the country. So now the restaurants are struggling to get anybody back in the kitchen and into the dining room. In fact, I talked to one woman who owns 4 restaurants, and she said she actually had to offer vacations to Costa Rica to get some of senior management people to come back and work for her in her restaurant. Back to you.
And of course, besides those restaurants, New York is famous for being home to many of the world's biggest banks, other organizations. How are they handling this transition of having workers come back to the office?
Well, you know, as far as workers coming back to the office, we have big banks like JP Chase that are continuing to build their massive worldwide headquarters here on Park Avenue in New York, building 24 hours a day over the last 6 months. They didn't stop because of COVID-19, really. Jamie Dimon, of course, saying that he wants most of his workers to come back in the fall into the city to work in the offices. However, JP Chase started to hedge their bets. A few months ago, they started to rent out tens of thousands of square feet in their existing offices because they're not quite sure what kind of traffic they're going to get coming back into the city.
And of course, Frank, even though the efforts of those essential workers are being celebrated and commemorated, it's far from over, is it?
No, it's not over. You know, now that the numbers have gone down with COVID-19 infections, there is the Delta variant that is starting to creep up in the numbers here in New York City, and also across the river in New Jersey. They've had more than 36 new cases of the COVID-19 Delta variant. And we spent a day yesterday with one of the leading epidemiologists over there. Let's hear more about what she had today to say in our story. Delta variant infections have been reported in at least 85 countries and in all 50 states in the U.S. Experts say Delta now accounts for 1 in 4 cases nationwide, and the symptoms are similar to other COVID-19 variants.
So the same cough, loss of sense of smell, difficulty breathing. We are seeing that we're finding more symptoms. Now, we see a similar trend with who's more likely to have severe illness. In terms of the age spectrum, younger people have less severe illness, older people are more likely to be hospitalized and potentially need a ventilator.
And the people who are most at risk for contracting the virus are people who are not fully immunized.
What concerns me more are people who are vaccine resistant, who are unwilling to get the vaccine under any circumstance.
The vaccine's not safe because they didn't do their due diligence. They didn't go ahead and put it through all the tests they normally do.
We all know powerful variants have emerged, like the Delta variant. But the best defense against these variants is to get vaccinated.
New York health officials say the Delta variant has become the second most dominant strain in the city. Here in New Jersey, it's represented nearly 16% of the new cases over the past 4 weeks. And this state has also been hit with 3 other COVID-19 variants from Brazil, the UK, and South Africa. A study conducted by Public Health England this month showed 2 doses of the Pfizer vaccine proved to be 96% effective against hospitalization from the Delta variant, while 2 doses of the AstraZeneca vaccine was 92% effective. Johnson & Johnson says its single-shot COVID-19 vaccine generated strong, persistent activity against the rapidly spreading Delta variant. The World Health Organization has recommended everyone continue to wear masks to slow the spread of the virus, but the CDC maintains that fully vaccinated Americans can go without masks in most situations.
I think I feel like you're okay outside. As far as inside, I guess it's about proximity. And I know that as far as where I work, on my side gig, we still are observing that 8 to 10 foot rule.
Experts now believe it's unlikely that we'll ever return to a time when we are not plagued by a virus outbreak somewhere in the world. Frank Ucciardo, TRT World, New Jersey.